General anesthesia, the essentials. Let's break down the basics. Your guide to what happens when you go under. Hey everyone, welcome back to the Everything Surgery podcast. Today, we're diving into a super important topic, general anesthesia. Whether you're curious, prepping for surgery, or just love learning how medicine works, this episode is for you. So let's jump right in. What is general anesthesia? Alright, so when we say general anesthesia, what we're talking about is a medically induced state where you're unconscious, pain-free, with no memory of what's going on and your muscles are nice and relaxed. In other words, it's what makes surgery, or any major procedure possible without you feeling or remembering a thing. Doctors use a mix of IV and inhaled drugs to get you there, and to keep you there until it's all done. The recipe for anesthesia. What's in the mix? Let's break down the recipe with the classic triad of anesthesia. Well, it's actually a pentad now. Fancy, right? Unconsciousness, hypnosis, you're not awake or aware. Think, propofol, sevoflurane, the heavyweights, analgesia, no pain. Thank opioids like fentanyl and morphine for this one. Plus some NSAIDs for good measure. Muscle relaxation. Surgeons get a still field. You get a nap. Enter rocuronium and succinylcholine. Amnesia. You won't remember a thing. Thanks. Midazolam and propofol. Autonomic stability. Keeping your heart rate and blood pressure in check. Beta blockers. Anticholinergics. You name it. The journey. Stages of anesthesia. aka Goodall's classification. Now, here's where it gets interesting. Anesthesia isn't just on or off. There are stages. 1. Stage 1. Analgesia. You're awake, but chilled out and not feeling much pain. It ends as soon as you lose consciousness. 2. Stage 2. Excitement. This is where things get wild. Breathing goes wonky. You might move around, but with today's drugs, we slide through this part pretty quickly. 3. Stage 3. Surgical anesthesia. This is the sweet spot. Unconscious. Regular breathing. No reflexes. Surgeons love this. 4. Stage 4. Overdose. This is not where we want to end up. Breathing and heart function crash. If it happens, it's all hands on deck. Stat. The players. Drugs you'll meet under anesthesia. Let's run through the all-star lineup. Induction agents. Propofol. The MVP. Thiopental. Etomidate. Ketamine. Or even inhaled agents like sevoflurane. Great for kids. For staying under. Maintenance. Inhaled anesthetics like sevoflurane, isoflurane, nitrous oxide, or continuous IV infusions. That is total intravenous anesthesia. Tiva. Analgesics. Fentanyl. Remifentanil. Morphine. Sometimes NSAIDs or paracetamol join the party. Muscle relaxants. Succinylcholine. Super fast. Doesn't last long. Rocuronium. Vecuronium. When it's time to wake up, neostigmine or sugammadex help reverse the effects. Extras. Benzodiazepines for calming nerves. Antiemetics for nausea. Anticholinergics for heart rate stuff. How do docs keep you safe? Monitoring 101. This is where the science and the gadgets shine. ECG. Watching your heart rhythm. Oxygen saturation. Oxygen levels in your blood. Critical. Blood pressure. Non-invasive or with an arterial line if things get tricky. And tidal CO2. Making sure you're breathing right. Temperature. Especially to catch rare but scary things like malignant hyperthermia. Neuromuscular monitoring. Making sure those muscle relaxants are working and wearing off as planned. Advanced BIS monitors for how deep you're under. Invasive BP. Central lines. Mostly for critical or lengthy cases. What can go wrong? Let's keep it real. Anesthesia is safe, but stuff can happen. Here's what gets watched for. During surgery. Airway trouble. Laryngospasm. Bronchospasm. Tough intubations. Cardiovascular. Low blood pressure. Arrhythmias. In rare cases. Cardiac arrest. Respiratory. Not breathing enough. Risk of stomach contents getting into lungs. Malignant hyperthermia. Really rare, but a medical emergency. Treated with dantrolene. After surgery. Nausea and vomiting. Super common. Like 1 in 3 patients. Sore throat. From the breathing tube. Post-op delirium or confusion. Especially in older folks. Lung stuff. Like atelectasis. Lungs not fully expanding. Or even pneumonia. Recovery. What happens next? So, once surgery's done, you'll wake up in the post-anesthesia care unit. That's the recovery room. Docs and nurses keep a close eye until you're breathing well, pain's controlled, and you're not nauseous or dizzy. Once you're good to go, vitals stable, alert, they'll send you home or up to your hospital room. Quick recap. Takeaways for the road. General anesthesia. It's unconsciousness, pain relief, muscle relaxation, and amnesia in one package. Induction. Usually IV with propofol. Maintenance can be with gases or more IV meds. Monitors. Heart, lungs, oxygen. Always on watch. Complications. Most are rare, but the team is trained and ready. Recovery. Monitored till you're safe and steady. That's it for today's rundown on general anesthesia. If you learned something new or have questions, drop a comment and don't forget to subscribe for more deep dives into medical topics. Thanks for listening, and stay healthy.